Hello everyone and welcome back to another insightful episode of MedSynapse podcast series. I'm your host Tejisha, and today we're tackling a topic that affects millions but is often underestimated, which is from snoring to sleep apnea, a pulmonologist approach to diagnosis and management. And joining me is Dr. Raju, a consultant in pulmonary medicine and sleep medicine at Care Hospitals in Manjara Hills in Hyderabad with over 15 years of experience. His expertise spans from sleep medicine, interventional pulmonology, bronchoscopy, EBIS, thoracoscopy, and comprehensive sleep disorders. He is certified in PAP therapy, trained by Indian Sleep Disorders Association, and deeply committed to evidence-based patient-centered care. So, Dr. Raju, it is such a pleasure to having you with us today.
Pleasure is mine.
So, Doctor, let's just start with our discussion today. So, snoring is often dismissed as harmless, but clinically that's not always true. So, in your practice, what red flag features help you differentiate simple snorers from those who have been early obstructive sleep apnea?
Basically, snoring occurs when there is obstruction in the airway. So, whenever your upper respiratory tract gets blocked or gets narrowed, one tends to snore. So, what happens is usually, all the snoring, whoever snores, we don't consider them having a disease. So, when to get alarmed and when to evaluate a person who is snoring. So, when a snorer also has some kind of alarming signs like when their daytime activities are getting affected, or when their sleep is not continuous and getting interrupted, one tends to get disturbed sleep and have a daytime consequences, feel tired all during the day. So those people should be evaluated for any suggestion of sleep apnea. For example, a person may be sleeping for more than 8 hours, but he will not feel fresh the next day. So what is happening is he's not having a quality sleep. So that needs to be addressed.
Yeah, I think that's those distinctions are crucial for early interventions also, I would say. So now, doctor, let's just take this a step further. So when interpreting borderline AHI values, what additional parameters like the oxygen desaturation index or arousal index help you guide your treatment decisions?
AHI is basically an apnea hypopnea index. It's basically a parameter which tells in an hour during the sleep how many times the breathing is being interrupted. An OXA is divided on basis of AHI. So it is divided into mild, moderate, and severe. So whoever has AHI of 5 to 15 is considered mild, and whoever has 15 to 30 is categorized as moderate, and more than 30 is like severe. So for everyone who has AHI more than 5 does not require any active treatment. Lifestyle modifications will be sufficient for that. For example, if a patient who has an AHI between 8 to 10, if he doesn't have any symptoms, they doesn't require any long-term treatments and all, just a modification of their lifestyle. But if a patient who has an AHI of 8 to 10 and has some symptoms, they need to be treated categorically.
Correct. A great explanation of AHI, and it never tells the story by itself, I suppose. So now let's just talk about risks. So OSA is tightly linked with cardiometabolic health. So from your experience, which comorbidities like obesity, hypertension, insulin resistance, or craniofacial abnormalities tend to worsen disease severity the most?
Although all the factors mentioned by you can worsen the severity of OSA, the main factor which directly affects is the obesity. Why? Because obesity, when a person has deposition of fat around his airway or neck, so what happens is the airway gets narrowed, causing snoring, and snoring in turn, long-term snoring can cause decline in the tone of the pharyngeal muscles, which in turn can cause OSA. So, and the other factors like hypertension or the insulin resistance, those are mostly a consequence of the OSA. The long-term OSA patients will have this, can have a tendency to develop hypertension, especially due to, as the patients have intermittent hypoxia during their sleep, which can surge the sympathetic, have a sympathetic surge, causing damage to their vessels, and in turn raising their BP. So most of the people who are who are not getting the BP controlled even after starting a couple of medication, they must be evaluated for sleep component. And in the same way, the persons whose sugar is not being controlled even after following proper medication, proper lifestyle, even the sleep component should be addressed and treated accordingly.
Correct. I think that really highlights how multi-systematic the condition is. Now, doctor, let's just speak about management. So, CPAP remains the gold standard, but compliance is always a challenge there. So, what strategies or technology integrations have worked best for you in improving patient adherence?
Whenever we diagnose a patient, the patient must know what exactly his problem is, how severe is his problem. So, without explaining and without patient knowing about his condition, if we directly ask him to take this CPAP and use it, some people may use that properly, some people may have difficulty to getting adjusted for that, some people may feel uncomfortable and all these things. So the first thing is we have to explain what is his condition, how severe his OSA or sleep disorder is, and what is the benefit of using the positive ambient therapy, and what happens if he doesn't use this PAP therapy. If at all he totally denies taking PAP therapy, we should not leave him alone. We should not leave him like that. We should at least counsel him for alternative therapies like advancement therapies or some alignment, jaw alignment therapies, or some kind of alternative treatment rather than leaving him alone.
Very practical, and these are the insights a lot of clinicians will look forward to also. So now, doctor, moving on to a clinical scenario, what key considerations should clinicians keep in mind while evaluating OSA in perioperative patients, especially regarding anesthesia risk stratification?
Yeah, basically OSA itself carries high risk of perioperative complications. Those people have this tendency of having hypoxia during the sleep. So whenever a patient is undergoing for a general anesthesia or any kind of sedatives or opioid exposure, those people tend to have a higher risk of getting a hypoxic state and all those things. So whoever is planned for a surgery who requires higher doses of anesthesia, those all people must be screened for OSA. At least a proper detailed history must be taken before taking them for the surgery. So when coming to the detailed history, most of the anesthesia or some physicians usually use this tool called stop bang score. Stop bang suggests that it's basically snoring, T for tiredness, O for observed apneas, and P for higher blood pressure. So whoever has these levels increased, they have this high risk of OSA. When the score is more than 3, they have a high risk of having OSA. Along with that, if the score is above 5, there will be a high risk of perioperative complications. So this tool is very helpful in the evaluation of this perioperative patients. And other than that, even post-operatively in these patients, we need to monitor them at least for a day so that they're not getting into getting any complications related to OSA and the other complications of anesthesia.
Yeah, I think that's such an important reminder also. And I think perioperative safety truly depends on proper assessments. Now, Doctor, finally, what message would you like to share with healthcare professionals about early detection, multidisciplinary care, and the future of sleep medicine?
As you told, early detection for any disease, early detection will be important. So, future is definitely bright with the advancements coming in the medical field. So, for example, we have many devices which can monitor your sleep pattern, your heart rate. You have this sophisticated, ring devices. You have the straps. So all these things measure your sleep parameters. And I'll give you an example. We had a patient, he typically had this OSA symptoms. So we have advised a sleep study. So he underwent the sleep study and his AHI was elevated and all these parameters were suggesting a severe OSA. So next day he comes with a report and tells me that, doctor, yesterday I was not comfortable with the steady wearing all the leads and all. So that's why this test may be not of complete relevance. So what I did was I tried to convince him, but he was like, no, every day I sleep well. Yesterday I was not able to sleep properly. So in order to prove his severity of the OSA, what I did was I've asked him to take this ring, wear it for 3 days, and we'll see after that. We'll see the parameters of his sleep after 3 days. So when I showed the parameters for consecutive 3 days to him and explained his condition, he was totally convinced and he accepted to have the treatment for OSA.
That's really interesting to know that example also. And I think sleep medicine is so much evolving with so much of awareness also increasing. So there's a lot of work to do, but it's still increasing, I would say.
Yeah. The awareness among the population is increasing. So early recognition and preventing the complications is helpful. Yeah.
Definitely. So, Doctor, as we wrap up this session, thank you so much for sharing such valuable insights today, from understanding subtle snoring patterns to navigating perioperative risks, and then just giving a good message also. So, thank you so much. And this has been an incredibly informative session.
Thank you, Raju.
And to our listeners, thank you for tuning into this episode of MedSynapse podcast series. And remember, if you're a healthcare professional who who's eager to delve deeper into medical topics or have questions, do not hesitate to join us on the MedSynapse platform. MedSynapse platform is not just a resource, it's actually a dynamic space where you can connect with your medical peers, participate in meaningful discussions, and contribute to the ongoing evolution of healthcare. So until next time, stay curious, stay inspired, and we'll see you in the next episode.